In clinical communication, we have a national curriculum, and it's a curriculum which has been created by all medical schools in the UK, for all medical schools in the UK, and UCL has been part and parcel of that process, a fundamental part of that process. And it's based on the principle that there are a number of essential building blocks of communication which students can learn and develop and then apply in all of the situations that they face. And what's important about that, it's difficult to see, but right at the centre, it's not a skill, it's an attitude or a value. And that value about respecting other people underpins all of our teaching. And so what we do throughout the curriculum is we teach those basic tasks and the basic components, and then we also focus on some specific issues as well. So for example, I know Faye's mentioned a couple of things, but we also teach students how to communicate through an interpreter, how to identify what someone's healthcare goals are, how to help and support patients in making the decisions that are right for them. At one point we also had a scenario where students had to respond to a patient who was either sexist or racist. And actually the most difficult part of that was trying to persuade our actors to be really offensive to our students. But anyway, we ran with it. And what was perhaps slightly unsurprising given the UCL students, what we have here, is that students responded with such emotional intelligence and grace to that scenario, looking after the patient, but also making it clear that they were supporting their colleagues, that actually they made it look really, really easy.